Now, today we are talking about the Guillain-Barré Syndrome. It is a post-infectious neurological disease that has caused a serious health concern across Pune and has impacted over 100 lives so far and one suspected death in Solapur. Authorities have launched a comprehensive surveillance effort, and the Deputy Chief Minister, Ajit Pawar, has announced free treatment for the affected residents. Investigations are underway to determine the cause, but what exactly is a GBS and what are the symptoms? Now, it is an autoimmune condition in which body's immune system attacks and damages its own nerves. A number of respiratory or gastrointestinal infections can cause GBS, but the condition cannot spread from one person to another, so it is not contagious. GBS typically begins with weakness, tingling or numbness in the legs and may progress to arms and upper body and can lead to paralysis. Other symptoms include unsteady walking, difficulty with facial movements, and abnormal heart rate or blood pressure. Some may complain of impaired respiration as well, with breathing difficulty being one of the most pronounced area of concern, and symptoms often develop over hours to weeks and require immediate medical attention. And despite the rising number of cases, there is no reason to panic, as GBS is not communicable or contagious. Now, a delegation of members from the World Health Organization along with the State Health Minister Prakash Rao Ambedkar visited Pune to take stock of the situation on ground and render all support. Listen in.
हमारी जो एक्सपर्ट की टीम है उसने यहाँ जांच की है, उसका जो रिपोर्ट आएगा उसके बाद ही हम लोग अपना राइट ओपिनियन देंगे।
सर एक जानकारी इसमें जो हाँ ये कितना खतरनाक है?
जीबीएस सिंड्रोम जो है वो प्रतिकार शक्ति कम होने के कारण जीबीएस सिंड्रोम का एक जो आजार है वो बढ़ता है। हालांकि इसमें मृत्यु नहीं होती, लेकिन एक पेशेंट यहाँ पेशेंट ये दुखद घटना हुई है, तो हम लोगों की ये जिम्मेदारी है कि ऐसा कुछ ना हो। इसलिए एक तो अवेयरनेस होना चाहिए, साथ ही साथ उपाय योजना होनी चाहिए। उसके लिए हम लोग अच्छी तरह से सरकार ने ऑलरेडी महात्मा फुले आरोग्यदायी योजना में इसका समावेश किया है। उसके मार्फत 2 लाख रुपए तक का इलाज वहाँ पर होगा। साथ ही साथ पुणे महानगर पालिका में भी कल घोषणा अजीत दादा पवार साहब ने की है, उसके माध्यम से भी इसके लिए हम लोग आर्थिक तरतूद कर रहे हैं।
And joining me right now is our guest this evening, Mr. Professor Dr. Sudhir Kumar, who is a senior consultant, neurologist, Institute of Neurosciences, Apollo Hospital, Jubilee Hills, Hyderabad. Well, good evening, sir. Thank you so much for taking our time, Dr. Kumar. Now, first and foremost, Mr. Kumar, I'll ask you about what exactly is a GBS, the Guillain-Barré Syndrome. Of course, we are talking about awareness so that people know about it.
Yeah, Guillain-Barré Syndrome is an acute neurological illness. So it is not something new. We know about GBS for the last 50 years or even more than that. And we have been seeing patients and treating them also, and most of them do get better. So basically it's an acute illness where the person all of a sudden starts weakness, and the weakness usually starts in the feet and ascends up to the knees and the hips, and then the trunk, and finally the upper limbs or the arms. And then some people do develop difficulty speaking, swallowing, facial weakness, and breathing difficulty. And this kind of development or progression happens very fast. It takes about say, a few days for the person to progress. And as per the definition, the worsening can happen up to 28 days. And beyond that, the worsening doesn't happen. And in most cases, say 30 or 40%, the symptoms may be very mild, but about half the patients do get paralyzed. And only about say 10 or 20% may get breathing difficulty, and only about less than 10% require breathing, for ventilation for the breathing difficulty.
Dr. Kumar, if I can ask you about how serious is this GBS, the Guillain-Barré Syndrome, because the fact that the manner in which the number of cases are rising, the number of cases that are being detected, that is definitely raising an area of concern, that is setting an alarm of sorts. But of course, we are telling our viewers over here, it is not contagious. But sir, how serious is the condition?
See, Guillain-Barré syndrome is a serious neurological illness because it can rapidly progress in some patients. When we see a person on day one, we don't know which person will progress and who will not progress. So, to the public, if anyone develops tingling, numbness, weakness in the feet, which is increasing, the weakness is increasing, they should consult a neurologist because this watching can be better done in the hospital. And if there is any eventuality of giving ventilation, it can be done, and then there are excellent treatments. So there are well-known treatments available and well-known treatments which are effective, like immunoglobulin injections and plasma exchange. Most of the standard hospitals have the facility for this. So it is a fully treatable condition. So and earlier we start the treatment, better the outcome. So the most important thing is the affected person should go to the hospital, consult a neurologist, and the treatment should be started earliest. And then more than 95% people recover. Some people do require physiotherapy rehabilitation for a few months, and if condition is treated, the death rate is less than 5% of all affected cases.
Dr. Kumar, right today, there have been 19 more cases reported in a single day, and it takes the count to above 100, and as many as 16 patients are on a ventilator. How do you explain this spate in the number of cases? What I'm trying to ask you, sir, is that, of course, this is not contagious. So how is the numbers rising? Is it because the testings have been increased, because of which these cases are being detected? But why are these cases only being limited to Pune alone?
No, in this case, definitely we are seeing a surge in the number of cases. So in a specific area, the doctors and the public, they are aware of the number of cases that we see. So typically they may be seeing, we have been seeing this in the last, say, 2 or 3 weeks, the recent surge of cases in Pune and around that. So usually they may see about 5 to 10 patients in this much period. So definitely this number is high. So we have to accept that there has been an increase or there is a surge in the number of cases of GBS. So some kind of outbreak is happening, and this is not the first time outbreak of GBS has been reported. So in the literature, there have been reports of outbreaks of GBS in Peru in 2019, where about 700 cases were reported. In this current episode also, some of the cases have been found to have this infection called Campylobacter jejuni. Now, this is one of the known bacteria which can trigger GBS, and some patients have confirmed Campylobacter jejuni. It is a gut infection. So patients who have C. jejuni infection, they can have stomach pain, cramps, loose stools. And then after about, say, 7 to 14 days after the gut infection, these neurological symptoms develop. So, and the good thing to note is that if about 1,000 people get infected with this Campylobacter jejuni, only one develops GBS. So if we can say that now we have 100 cases confirmed, so this would have required about 1 lakh people to have this C. jejuni infection. Out of 1 lakh, only 100 get. So 1 out of 1,000. So here definitely there's an outbreak, and the underlying infection, whether it is C. jejuni. So today we got the report that some samples have shown E. coli bacteria also, but E. coli is not a well-known pathogen which can trigger GBS. So that may not be the main cause. So most likely it seems to be C. jejuni, which could have come from the infected water sources. They are already investigating whether it is the water source and sometimes the infected food sources. So as of now, people should be careful. When they drink water, they should boil, and also hygienic food should be consumed. So whatever they are consuming, whether water or food, that should be safe and hygienic.
Absolutely. Thank you so much, Professor Dr. Sudhir Kumar. You have told us that GBS, the Guillain-Barré Syndrome, is not contagious. You've told us it is totally treatable. And you've also told us about how the rate of serious cases is below 5%, and that there is a need for people to be careful and boil the waters, and as far as the intake of food is concerned, that has to be most hygienic in these particular areas. Thank you, Dr. Sudhir Kumar, for taking our time and joining us over here at Mirror Now. But my colleague had taken stock of the ground as far as several of these hospitals preparing the influx of patients with GBS. Take a look.
जीबीएस बीमारी को लेकर जिला प्रशासन अलर्ट हुआ है। हम अभी इस वक्त पुणे कॉरपोरेशन के कमला नेहरू अस्पताल में हैं, जहां पर तकरीबन काफ़ी बेड यहां आरक्षित किए गए। हमारे साथ इस अस्पताल के डॉक्टर प्रशांत बोटे हैं। सर, क्या बताएंगे कितने बेड यहां आरक्षित किए गए हैं?
कमला नेहरू हॉस्पिटल में 45 बेड आरक्षित किए हुए हैं। 15 मेल्स वार्ड में, 15 फीमेल वार्ड में एंड 15 बेड आईसीयू के आरक्षित किए गए हैं।
कब आपको ये बताया गया था कि इस तरह के बेड आपको यहाँ आरक्षित करना है, कब की जानकारी थी?
2 दिन पहले की जानकारी थी हमें कि हमें जीबीएस के लिए प्रिपेयर रहना है, तब से हमने हमारे बेड आरक्षित किए हुए हैं और हमारी तरफ से सब कुछ सुविधा उनको फ्री में देने वाले हैं।
तो अभी तक के इस 2 दिनों में कोई जीबीएस का रुग्ण या ये मरीज यहाँ आया है?
अभी तक कोई पेशेंट एडमिट नहीं हुआ है, बट हमारे जानकारी में ये है कि बहुत सारे पेशेंट्स खास प्राइवेट हॉस्पिटल्स में एडमिट हुए हैं।
बीमारी को देखते हुए किस तरह से अलर्ट किया गया है, किस तरह सर्वे हुए हैं, आपकी तरफ से कुछ सर्वे किए गए हैं?
जी, पुणे महानगर पालिका की तरफ से लगभग 20,000 हाउस टू हाउस सर्वे किए गए। उसमें से हमने 70,000 पॉपुलेशन को स्क्रीन किया गया ताकि जानकारी मिल सके कि और कितने पेशेंट्स बढ़े हुए या है या नहीं एरिया में। और जन जागृति के लिए हमने वहाँ पे पैम्पलेट्स बांटे हुए हैं ताकि लोगों को इन्फॉर्मेशन मिल सके जीबीएस सिंड्रोम के बारे में।
तो आप देख सकते हैं कि इस अस्पताल में यहाँ 45 बेड आरक्षित किए गए, जिसमें से 15 वेंटिलेटर बेड है। इस तरह की जानकारी डॉक्टर ने हमें दी है। बड़ी खबर सामने ये आ रही है कि अभी तक के पुणे शहर में तकरीबन 100 से ज़्यादा मरीज जीबीएस के हैं, जिसमें से 81 पेशेंट जो रुग्ण है वो केवल पुणे शहर से है और इसमें से एक जो मरीज है, जो रुग्ण है, इनकी डेथ इस जीबीएस बीमारी में हो चुकी है।